So let me present the 4-level fascial manipulation. I know people are asking what you are going to learn. Of course, with level 1, we are going to learn the basic principle that you need to treat disorder, dysfunction, musculoskeletal problem that are mostly related to motion. So the patient said, look, I have pain on my shoulder when I move. That is typical problem related to the central coordination. So location in the deep fascia where the 3 plane of motion will generate the final vector for the movement of the distal joint. What does it mean? The myofascial unit, so the basic functional element that works for motion, can be altered if there's a lack of gliding or underlying fascia. So we will talk about myofascial sequence, myofascial unit, something that is well known worldwide. In level 2, we will work more for complex motion, symptoms that occur with the complex motion or no motion. Because the center of fusion where multiple vectors converge to generate the complex motion can be affected. So the patient can tell you, look, I have pain when I play tennis, when I do a particular type of activity, sport, but also I have pain when I do not move at all. So I'm sleeping, when I'm driving back home, my shoulder hurts more when I'm in the sofa watching TV. So in this case, the information that you will learn as a diagonal disposition of the central fusion, spiral disposition of the central fusion, will help you to understand how this complex gesture or how this non-motion will generate these symptoms that are mostly related also to nerve entrapment. On level 3, we'll add all of that information, also the compensation that can occur in the visual organ. So, all the people have internal disorder. Sometimes most of the time are idiopathic. They don't really understand the origin of the problem. And fascia, the visceral fascia that are extremely well represented in our body, can affect the mobility and motility of the organ. We know that each organ have its own mobility, own motility. So if there is an impairment of that, we have a dysfunction. And this dysfunction can really affect quite our life. Talk about bloating, reflux, gastritis, stress incontinence, short of breath, lack of voice, lump in the throat, okay, all kind of headaches, okay. But on top of that, we talk about dysmenorrhea, cramps, all symptoms that can be related to a dysfunction. So not change of anatomy, but a change of the activity and change of the gliding of the visceral fascia. So it would be very exciting to see how a lot of problems are viscosomatic. You have a knee pain that you think that is a musculoskeletal. My reality was originated by the important dysmenorrhea, a long-lasting, bladder infection. So if you don't understand this origin, you will fail because you treat, it seems better than the pain, but then come back. So the level 3 will be very important also to fix musculoskeletal problems that have visceral origin. And then to finalize, we have level 4. Level 4 is strongly related to the superficial fascia. Superficial fascia is related to lymphatic system. So lymphatic spasm, lymphedema, we will treat about that. It's related to the superficial nerves. So, paresthesia, dysesthesia, renal, but also CRPS are extremely related to this problem. As well to the adipose tissue, painful cellulitis, alteration of the consistency of the subcutis like in fibromyalgia. These are typical disorders that we will see in level 4 and that require a knowledge of the peripheral part of our body that is, by the way, the superficial fascia. So looking forward to see you in the upcoming videos.